about when your mask fitting happens. You just found out you have sleep apnea. You are still absorbing that. There is a machine you have never seen, a hose, a mask, a new way of life. You are in no state to ask good questions, so you don't ask any. And that is the first step in treatment failure. Not the mask, not the pressure, the appointment where nobody knew what to ask. So here are the 5 tips for a successful mask fitting. If we haven't met, I'm a sleep doctor from Indiana's Amish country, 30 years helping thousands reclaim energy, intimacy, and life through sound sleep. Tip number 1, bring your bed partner to the appointment. I know it sounds like a soft item on the list. It isn't. The American Thoracic Society specifically recommends involving partners in mask selection. And I would push it even harder than they do. Here is why. You are asleep. You cannot hear yourself. Every piece of information about how that mask behaves for 8 hours belongs to somebody else. Your partner will tell you the hiss starts when you roll to the left, that the mask shifts when you turn over. Then there is a noise keeping them awake. You have no idea. Better information than any sizing chart in the room. And something happens when the spouse sits with you. The mask stops being a problem. It becomes a device you both are trying to adjust to. You both are trying to succeed. You are now a team trying to get your bedroom and your life back. Tip number 2, know whether you breathe through the nose or mouth or both. Work this out before you go. When you wake up, is your mouth dry? Is your nose blocked at night? Is it positional? Seasonal? Do you have allergies? This decides the style of mask. Nose breathers do well with a laser mask or laser pillows, which are small and light and touch almost nothing. The mouth breathers, on the other hand, usually get sent to a full face mask which covers the nose and the mouth. Here is where it goes sideways. Somebody sees an open mouth and reaches for a full face mask. Sometimes that's right. Some people generally need it, but often the mouth is open because the nose is congested. Treat the congestion, treat the allergies, and a chin strap with the nose mask, and the mouth closes on its own, and you breathe through the nose. And here is something I've heard from patients for 30 years. They come back after a few weeks on CPAP and say, I'm breathing better through nose than ever before. The gentle pressure the CPAP pushes through the nose helps keep the nose open. And also, the American Thoracic Society reports that most patients who are breathing through their mouths switch to nasal breathing once they are on a nasal mask. Which means mouth breather is not a permanent label. It's a starting point. The American Thoracic Society position is that a nasal mask should be the first option for most patients. And in a study published last year, 3 out of 4 patients already on a full face mask moved to a nasal mask successfully and preferred it once they did switch. So know your nose before you go. If the congestion is the real problem, say it loud. That's a nose to treat, not a bigger mask to wear. Now, tip number 3. Ask to be fitted lying down in the position you actually sleep in. Sit up and your face is one shape. Lie down and gravity moves everything. The cheeks shift, the tissue settles, the distance between the bridge of the nose and the upper lip, that changes too. The mask that sits perfectly in the chair can open the second you are horizontal. Then roll to your side. Check it again. And most of you do sleep on your side. People say they are back sleepers, but you start on your back and spend half the night on your side. Ask the person you brought with you. They know. a side sleeper drives the mask into the pillow. The pillow pushes the frame. The frame leaves the cushion of your face on the other side. And now you've got a leak at 2 in the morning that never showed up at the fitting appointment. If that's you, you want a low profile nasal pillows or a mask with a tube coming on the top of your head instead the front of your face. And have them turn the machine on at your pressure. They may start at 4, but ultimately you should test it at your pressure. A mask can hold beautifully at low pressure. Let go at 3 in the morning when the pressure climbs up. Sitting up, machine off, 2 minutes at a counter is not a fitting, it's a guess. Tip number 4, ask about the 4-mask rule. In 2023, the American Thoracic Society put out a policy statement on sleep apnea care, and in that, they recommend patients be allowed at home trial of up to 4 masks to improve the odds of landing on one that fits. 4, at home, in your bed. That's a recommendation to insurance, equipment companies. Not a guarantee. Policies vary. In most exchange windows run about 30 days, but the number is in the official statement. It tells you what good care is supposed to look like. The same statement says, poorly fitting masks are the most common cause of side effects from the therapy. Not the pressure, not the machine, the mask. So ask on the day, what's your exchange policy and how do I try a different style at home if this one doesn't work? Number 5, live with partner number 2, the therapist fitting you at the home medical company or in the sleep clinic. That's not a person, a salesperson handing you a box. No, that's your partner. That person is the most useful human being in your first month. In my clinic, I call the ones CPAP geniuses, and I mean it. They can look at a leak pattern and tell you the cause before you finish describing it. So don't walk out with just a mask. Walk out with a name, a phone number, and a follow-up date. Ask how and when the follow-up happens, not if, when. Because British researchers followed 1,000 CPAP patients across 5 sleep centers and watched the first month closely. 98% of the people who were struggling at 3 months were already struggling in 1 month. Not one person in 50 turned it around later, which means a follow-up at 90 days is not a follow-up. It's a post-mortem, unfortunately. So ask for a check-in inside the first 2 weeks. Ask who to call when something goes wrong at 11 at night. And ask whether they can see your machine's data remotely. This is because most of them can. You just have to ask. A leak shows up in those numbers before you notice it yourself. And after that, use them. Call them. That's their entire job. Bring your bed partner, know your nose, get fitted lying down the way you really sleep at home. Ask about the 4-mask rule and live with a therapist who knows your name. You walked into that appointment in no state to ask questions. Now, you're far of them. Write down, ask them. Because the goal was never a perfect mask on the first try. The goal is a mask you forget you're wearing. And the pair of glasses so comfortable you forget you are wearing them. Remember these 5 tips. Once again, bring your bed partner. Know your nose. Get fitted lying down the way you really sleep at home. Ask about the 4 masks rule. Live with a therapist who knows your name. The first chapter of my book, CPAP is Sexy, is free at dryatinjpatel.com/chapter1. It's about what's waiting on the other side of that mask. Not just better sleep, your energy, your presence, and the person your family has been waiting to get.